My name is Daniel Gonzalez, and today we're going to be doing special tests of the elbow, the wrist, and the hand. So the first one we're going to do is the valgus stress test. So we'll have the patient extend their arm with a little bit of flexion. We're going to put stabilizing hand on the one hand on the distal portion of the forearm and the other hand on the lateral aspect of the elbow, and I'm going to put a medial force at the elbow in, or a valgus force, which has the name valgus stress test. And in this I'm looking for laxity. A laxity would indicate a positive test and would indicate a medial collateral ligament injury or sprain, more than likely sprain. But I'm looking for laxity, so I'd go and do that on both sides. So I'll grab the other hand and do the same thing. And a positive test would be laxity. And then the second test we're going to be doing is the varus stress test. So we're going to have the patient have the arm in the same position, just flexed a little bit. And then instead of putting the testing arm on the lateral aspect of the elbow, you switch it and put the testing arm on the medial aspect and put a lateral or a varus force. And again, you're looking for laxity, so we're going to come over here and do it on the other arm, same position. Alright, and again, a positive test would be laxity. That would be indicative of a lateral collateral ligament. So the next test that we're going to do is the passive lateral epicondylopathy test. And we're looking for pain in this movement. So we're going to have the patient have their arm extended all the way, and then we're going to flex the wrist and then do ulnar deviation. So radius is on this side, the ulnar is on this side. So do that. So arm down. So ulnar deviation. And if there's any pain with that, that's the sign of a positive test, which can indicate lateral epicondylopathy or tendinopathy. And the next test that we're going to do is the active lateral epicondylopathy test, which again is looking for the same thing, pain, and if there's a positive sign, there's pain, it's a positive sign, and that's a sign of lateral epicondylopathy or tendinopathy as well. And the way we're going to do this is we're going to have the patient have their arm flexed at about 90 degrees, and they're going to resist wrist extension. So I'm going to try and extend the wrist, and I'm going to try and deviate that way. So I'm going to try and do that, and they're going to resist it. And if there's any pain with that, then again, that's lateral epicondylopathy or tendinopathy, or it's indicative of that. Alright, so the next test that we're going to do is the passive medial epicondylopathy test. And so we're going to have the patient again with that extended arm, and this time we're going to extend the wrist, and again ulnar deviation like you told us in class, extension and ulnar deviation, so it's going that way. And if there's pain there on the medial epicondyle, that's a positive test, and again that's looking for epicondylopathy or tendinopathy. This time of the medial. On the lateral ones it was lateral, but this time is of the medial. And then the active medial epicondylopathy test you're going to try and extend the me as a clinician, I'm going to try and flex, and they're going to try and resist. And if there's any pain in that medial epicondyle area, again, that's a positive sign and indicative of a medial tendinopathy or epicondylopathy. And then the elbow flexion test, we're going to have the patient just sitting like this, and we're going to have them put the arms like this with the palms facing upward and trying to extend those wrists as much as possible. And we're going to have the patient in this position for 3 to 5 minutes or until symptoms persist or show up, I guess, which in this case a positive sign would be paresthesia, and that would be a sign of ulnar nerve entrapment or compression. The test we're going to do is the radial and the ulnar collateral stress test. And so it's going to be similar to the stress test at the elbow, except at the wrist, obviously. So we're going to have the wrist here, and we're going to stabilize the distal radius and the ulna, and we're going to go in radial deviation for the ulnar stress test, and for the radial stress test we're going to go in ulnar deviation. And what we're looking for, a positive sign would be pain or laxity. And because laxity could be a sign, we're going to compare it to the other side. Again, stabilize the distal radius and the ulna, and then do radial deviation to stress that ulnar collateral ligament, and ulnar deviation to stress that radial collateral ligament. And if there's any pain or laxity on either of those after comparing them to the uninjured side, that's a positive test and a sign of a radial collateral ligament or an ulnar collateral ligament injury or sprain. So the next test that we're going to do is the Phelan's test. This one we're looking for carpal tunnel syndrome, and a positive sign would be paresthesia, and anywhere down that arm that median nerve goes to. So we're going to have the patient connect the dorsal side of their hands and then kind of flip it upside down, and their elbows should be below their hands, and their dorsal parts of their hands should stay together, and we'll have them stay in that position for about a minute or until that paresthesia sets in, and that would be a positive sign if there's paresthesia. And again, that would be a sign of carpal tunnel syndrome. And the next test that we're going to do is the Finkelstein's test. So we're going to have the patient make a fist and put their thumb inside that fist, and then we're going to flip it so that's pronated, and then we're going to move that wrist in ulnar deviation, and it can be either passive or actively. And if there's a reproduction of symptoms, then that would be a positive sign, a positive test, and that would be a sign of de Quervain's disease, de Quervain's syndrome. So the next test that we're going to do is the varus and valgus stress test of the fingers. And so what we're going to do for that, we're going to have the patient with their arm flexed, elbow flexed, and their fingers extended. So we're going to be stabilizing the proximal aspect of whichever finger we're testing. And then for the valgus stress, valgus force, we're going to be going like in the ulnar direction, and then for the varus, they're going to be going towards the thumb direction of the wrist in this case. And we're going to be applying those forces on those different joints, the interphalangeal joints, the proximal and the distal. And what we're looking for in this is laxity, and because we're looking for laxity, we're going to be testing that on the other joints on both hands. And if there's laxity, that's a sign of a positive test. And a positive test is that there's some kind of collateral ligament injury. More than likely, it's a collateral ligament sprain, depending on which force, the varus or valgus force, is applied, and that's where the laxity is found. The last test that we're going to go over today is the trigger finger test. So we're going to have the patient sitting with their elbow flexed, their hand supine, and I'm going to be palpating their distal palm where that tendon is, and I'm going to, they're going to flex all their fingers together, and then they're going to extend them as much as they can. And a positive test would be if we find a painful nodule in the palm, or if one of their fingers isn't able to extend. So let's say if this finger, all these were extended, and if this was like stuck right here, and that would be a positive test, and that would be the finger locking or the painful nodule would be a sign of a positive test, which would be a sign of flexor tenosynovitis.